Late Madam Sarah Ayoka Oduwaye was born in Lanwa village, Moro local government area of Kwara State in early 1932. She got married to Mr. Oyetade Oduwaye, a railway worker, in 1957. She followed her husband to many parts of Nigeria as dictated by the demand of his work with the Nigeria Railway Corporation. On retirement, the couple settled in the husband's village, Kurere, in the present Abeokuta North local government area of Ogun State. She was diagnosed with metastatic breast cancer in late 1983 and she died of complications of the disease on the 29th of October 1984. The Sarah Ayoka Oduwaye Foundation SAOF Breast Cancer Charity was set up in her memory by her son, Dr. Olayinka Oduwaye, in 2008 to create awareness and prevent this unfortunate disease within the community. The aim of Sarah Ayoka Oduwaye Foundation Breast Cancer Charity is to assist with the prevention of cancer in the community by providing free education and advice on some of the most common causes of cancer, providing free education and advice on self-help preventive measures, advocating and encouraging regular checkups within the community, because an early diagnosis of cancer means a good chance of a cure. Providing advice and support and advocacy by signposting identified sufferers to the appropriate sources of help and resources within the local community. Prevention through positive proactive education and information dissemination is always better than cure. The purpose of this video is to educate viewers on the steps to take to detect breast cancer very early, which eventually leads to a very high cure rate. It is important to note that early detection plays a vital role in this direction. Breast cancer has been reported in males but is rare. We're therefore going to concentrate on breast cancer in women. Happy viewing. Cancer could be as bad as this. Don't let this scare you. This is the truth, but you can prevent this with an early detection of breast cancer. Clinical diagnosis of breast cancer. Your healthcare provider can use any of the investigations below to make a diagnosis of breast cancer. Clinical breast examination, when the doctor examines you using his skills. Breast lump excision and histology. Here the doctor performs an operation to remove the lump. Mass imaging MRI. Computerized axial tomography CT scan. Isotope scanning. One or two of these tests needs to be repeated every 6 months and could be very expensive. Many women in developing countries cannot afford the cost. But don't panic. There is a simple way out. Self-breast examination can detect breast cancer early with increased prospect of cure. Self-breast examination is to be performed each month. Knowing what is normal for you and what your regular monthly changes in the breast feel like is the best way to keep an eye on the health of your breast. Please note that breast tissue extends from under your nipple and areola up towards your armpit. Timing of self-breast examination. If you are premenopausal, that is, you are still menstruating, set a regular time to examine your breasts a few days after your period ends. This time, your hormone levels are relatively stable and breasts are less painful. If you are already menopausal, that is, you have stopped menstruating or have not had your periods for a year or more, pick a particular day of the month to do the examination and then repeat your self-breast examination on that day each month. Of self-breast examination. Time required 10 minutes a month. What you need: a mirror which lets you see both breasts, a pillow for your head and shoulders in privacy. Visual examinations steps 1 to 3 are done in the front of a mirror. Step 1. Visual examination, hands by the sides. In the privacy of your bathroom, Strip to the waist and stand before a mirror. You will need to see both breasts at the same time. Check the appearance of your breasts. Look at the size, shape and contour. Note changes, if any, in the skin color or texture. Look at the nipples and areolas to see how healthy they look. Visual examination, hands on hips. Repeat above, but with hands tightly on the hips. Step 3. Visual examination, arms over your head. Still standing in front of the mirror, raise your arms over your head and see if your breasts move in the same way, and note any differences from previous examination. Look at the size, the shape and drape. Check for symmetry. Pay attention to your nipples and areolas to see if you have any dimples, bumps or retractions, indentation. Look up towards your armpits and note if there is any swelling. Steps 4 to 6. Manual examinations. These stages are best done in the shower, as wetting will have the least resistance to the friction of your fingers. You could also use a lubricating cream to make the movement of the hands less harsh. Step 4. Manual examination, stand and stroke. Raise your left arm over your head and use your right hand fingers to apply gentle pressure to the left breast. Stroke the breast from top to the bottom, moving across from the breastplate across all the way into your armpit area. You can also use a circular motion, being sure to cover the entire breast area. Take note of any changes in texture, color or size. Switch to the other side and repeat. Step 5. Manual examination, checking your nipples. Still facing the mirror, with the index and middle fingers of your right hand, gently squeeze the left nipple and pull forward. Squeeze your breast towards the nipple to check if any fluid comes. Does the nipple spring back into place? Does it retract into the breast? Note whether or not any fluid leaks out. Reverse your hands and check the right nipple in the same way. Step 6. Manual examination, recline and stroke. This is best done in your bedroom where you can lie down. Place a pillow on the bed so that you can lie with both your hand and shoulders on the pillow. Put your left hand behind your head. Use your right hand to stroke the breast and underarm as you did in step 4. Take note of any changes in texture, color or size. Mark your calendar to remind yourself to do your self-breast examination regularly. This is a good way to prevent worry if you find a normal cyclic change. Stay relaxed and breathe normally as you do your self-breast examination. Becoming tense will produce some knots that you may mistake for something worrisome. Report any changes or unusual pain to your healthcare provider or nurse practitioner. Keep a log of changes. Risk factors. The following risk factors are associated with breast cancer: history of breast cancer in the family, inherited abnormalities of certain genes, older than 45 years, being younger than 12 years at first menstruation, being older than 30 years at the birth of first child, older age at menopause above 55 years. Symptoms. Please note that in many cases, there are no symptoms. Findings on self-breast examination. The following are some of the changes to watch out for when you do your self-breast examination. A lump in the breast, an area of the thickening inside the breast separate from the other breast tissues. A dimple in the breast, redness, swelling, and thickening of the skin of the breast. It may be like the skin of an orange. A normally forward-pointing nipple retracts inside. Bloody or dirty discharge from the nipple. Enlarged lymph nodes in the armpit. If you notice any of the above changes, please contact your healthcare provider immediately. Conclusion. 1 in 9 women will develop breast cancer at some time in their lifetime. Breast cancer in men is rare, but very aggressive when it occurs. Breast cancer can occur in women from 25 years of age, but more common in women over the age of 50. Love yourself and your loved ones. Checking your breast regularly increases the chances of finding any changes early. Get to know your breast and what's normal for you. Look, touch, and check with your healthcare provider if you find any changes. 9 out of every 10 women who are diagnosed with early breast cancer survive the disease, who tell a happy story of life with cancer of the breast.